Hello, everyone. As we're getting ready to start here, welcome everyone into the room. We're just admitting a few more people. We'll get started right on target here in just a second. I am Kim Anderson. I am the Certified Healthcare Simulation Education Specialist and Customer Success Manager for AvKin. I am very happy and inspired to be joined today by our two presenters for this presentation of Aspiring Towards SIM Excellence in a New Era. We have with us Dr. Jayne Smitten, who is the President-elect 2022 for the Society for Simulation in Healthcare, a Fellow of Society for Simulation in Healthcare Academy, one of the inaugural FSSH Certified Healthcare Simulation Educator Advanced, the CHSE-A. Jayne is currently the Associate Dean Professor, Director of the Experiential Simulation Center for Hawai'i Pacific University's College of Health and Science Society. Society or science, Dr. Smitten? Society. And recently appointed as the Interim Chair for the Department of Public Health, Dr. Smitten continues in her efforts to lead these healthcare and society programs with the integration of simulation pedagogy into their curriculums. And also joining Dr. Smitten is Dr. Michelle Higgins. She's serving as the current lead simulationist and assistant professor for Hawaii Pacific University's new School of Nursing. Michelle's clinical specialties are in medical surgical arena, ER trauma, informed clinical practice, and community health nursing, with a keen desire to advance HPU's interprofessional simulation-based education. As I stated previously, the presentation portion of this is pre-recorded, so we're going to start that in just a second. And after the presentation runs, we will have live Q&A with our presenters. Again, we're so happy for you to join us, and we'll go ahead and get that presentation started.
Aloha.
Aloha, everyone, for the International Healthcare Simulation Week 2022. And my name is Dr. Jayne Smitten. I am currently the Associate Dean and Professor at the Hawaii Pacific University College of Health and Society. I'm also the Director of the Simulation Center and the Interim Public Health Chair. And I'm pleased to say I'm going to be the President in 2023 of SSH. I'd like to turn it over now to Dr. Michelle Higgins-Mahi, who will give a little overview of her background. Michelle.
Thank you, Dr. Smitten. Hi, I'm Dr. Michelle Higgins. I have been a simulationist for a very long time. I love to do sim. I work at the School of Nursing for Hawaii Pacific University. My background is in med surg and trauma, so it's very exciting to bring all of that experience into the simulation lab. Dr. Smitten, I'm going to hand it back over to you, and we'll go on to our next slide.
Right. So without further ado, we're just going to first and foremost let you know that the disclosures, there's no relevant financial disclosures, no conflicts of interest. Primarily what we're presenting to you today is what we've read, and what we've learned about in simulation, and our own experiences and our own opinions.
Yes.
So our objectives today, we're hoping that you will be able to, first of all, adapt, apply, or reinforce the 5 steps from the formula techno-sapien experts in your simulation-based education worlds. This was inspired by us, or inspired us in relation to this whole session, because it was a Formula One scenario on simulation, and they really grabbed our attention with the headline, "Don't guess about the future, simulate it." So that's where we're going with this one objective. The second one, of course, is to inspire to incorporate or advance an area of excellence in your particular community practice in the near future. And Dr. Higgins will be citing some examples relating back to where we have to really look at in regards to our roots, so that we move forward towards excellence in simulation. So over the next while, we're going to provide our views of these steps. And first and foremost, welcome to all of you who are taking this session in, you simulationists, techno-sapiens, or however you want to be identified. We've been reviewing articles and initiatives in many sources, and we were inspired and and really hope to share our reflections of that today. In addition, we'll be able to, at the end, have a live session for any Q&As that you wish to discuss with us. So onward. And technosapiens, well, essentially technosapiens are identified as the new intelligent species of Homo sapiens integrating technology. Next slide. And so for the purposes of our presentation, we're proposing the evolution of Homo sapiens with technology-driven imagination in our diverse worlds of simulation. So from this article, towards excellence and looking at what we're focusing in on applying simulation in our worlds, the step one in that article really focused on data, and simulation requires data. Simulation data curation is just essential for us to move forward in our worlds of simulation. We are going into a world of healthcare simulation, and we're trying to make a difference. So big data is important. Go back to data. The Formula One expert really states that curating the data fuels simulation. And so there's all kinds of data samples that we wanted to focus on today, and that is related to thinking about our research data from the many facets of where we come from, data on patient outcomes, data on evaluation, data on return on investment, even our learner contact hours data, because how these relate to our research and to our success in the future is very important information. Indicated in the article too is examples were abound regarding the educational development in simulation. So looking at where we're going and building our teams with audiovisual, virtual reality, augmented reality, robotics, there's just so much to learn. And so when we're looking at step two, we're really focusing in on building our simulation teams, all towards quality improvement and patient safety outcomes. This also takes into account our infrastructure planning, and that is something that we do need to focus on more, related to what is required for building our teams to make sure that we have the essential foundation towards creating those teams. Excuse me. We want dynamic, cohesive, collaborative teams, and we know that simulation is an art and a science, so it's taking that into consideration in relation to building our teams so that we have the diverse teams that address these particular areas of art and science. Next slide. Building our teams. We want to create, implement, and optimize our program goals wherever you are in your organizational development. And it's really important for us to explore and expand in a purposeful way. This came through loud and clear in relation to the steps for the Formula One team. And so again, the analogy and bringing this into the simulation teams world is so critical and crucial for our future. And then finally, strengthening the teams. The technosapiens refer to the simulation engineers and waking up and thinking about design. Well, we think about it in an analogy, we are creating, we're designing, there's inventing and researchers happening, researchers talking about things that we can do that relate to maybe our entrepreneurial work in the future. So all these are relevant to strengthening our teams and connecting with each other. The step three they talk about is employing offline sim approach. So we're creating, in their case, they were creating all kinds of scenarios and choosing the best. And in our cases, we have to think about what kind of scenarios we're producing related to the modality. Are we addressing learning styles, the unique abilities and the challenges, and also the what ifs, what's happening in our development of the sim scenarios that we need to realize and think about in the development towards excellence. Implementing offline sim is helpful because it helps optimize us towards the reactions and the outcomes. In step four, we're exploring human in the loop. So ideally, we're preparing and rehearsing, as well as having the actual individuals work towards what we need for the sim objectives and goals. That makes sure that's incredibly important to get the best bang from our objectives. Again, it reinforces the what if. When we're doing our rehearsals and preparation, we're starting to think about, what happens if this scenario changes, or this particular portion of the scenario creates a bit of a challenge. So the analogy from the Formula Ones is making sure that we test using the human factor. And that is ideal. It doesn't happen all the time. So that's something we want to address as well today and relate relationship to working towards excellence in the standards of practice for the development of our sim scenarios. And finally, step 5, democratizing sim data and analytics. We have so much to share with one another, and it's really important to make the sharing of the data and the information dissemination visual and accessible for all. We have so much insight and so much impact from our involvement of humans and technologies with simulation. So I'm hoping that we can focus on this in the future as well. And in saying that, I'm going to turn it over now to Dr. Higgins, who is going
for your introduction. Aloha, everyone. As Dr. Smitten has discussed, our future in simulation is rapidly evolving. We see simulation being used, as Dr. Smitten stated, in the areas such as Formula One. That's very exciting. Innovations in simulation are being used in very diverse environments, including, but not limited to, healthcare, in the military, flight training, gaming, and of course, some of the newest platforms, such as virtual reality, VR, and artificial intelligence, AI, are not only being used for entertainment, but are being incorporated into our learning environments. It is exciting to have all this advancement in the field of simulation, and I am sure we are all looking forward to what the future has in store. However, as sim educators, we need to be sure that we continue to build strong foundations as we move into our future innovations. As simulation training continues to expand and become increasingly common throughout education, educators have established best practices. Of course, this approach ensures that the simulation experience is consistent and provides the most benefit to the learners. To help guide educators, for instance, the International Association for Clinical Simulation and Learning states simulation best practice includes having defined goals and objectives, a sufficient pre-brief, an established case scenario, and adequate debriefing. We have found that the literature continues to reiterate the importance of conducting a briefing before the simulation training, as well as other foundational strategies. But we have also found that the literature continues to state that we are missing important roots and strategies within our best practices. Studies have shown, for instance, that briefing before cardiac surgery decreases disruptions and improves team communication. In simulation, the pre-briefing serves to set the tone for the upcoming learning experience. Importance of a pre-brief. The literature has identified that there are 4 components to briefing in advance of the simulation activity. They consist of reviewing the session's goals and objectives, establishing a fiction contract with learners, providing logistic details about the session, and pledging to respect the learners. I would like to review these 4 components. First, reviewing the session's goals and objectives. This component includes reviewing the learner's objectives, outlining the simulation session sequence of events, including the timing of the debriefing and the evaluation, familiarizing the learners with the simulation equipment and environment, and explaining the roles of the educators. By outlining what educator expects of the learners, they will be more engaged and have a greater chance to meet the session's expectations. For example, ensuring that the learner's objectives are given to students prior to the event may be a week, a day in advance, depending on what type of simulation is being done. As educators, we need to assess the needs of our students. This may mean that we send the new students very detailed pre-instructions or briefings, whereas more advanced students maybe just outlines. The next component is establishing a fiction contract. As we know, a fiction contract is an explicit agreement between educators and learners that the learner engagement is dependent on both parties. The educator is responsible for creating a scenario that is real and as possible within the limitations of the simulation environment. The learners are responsible for fully engaging in the simulation and acting as if everything is real. Learners should expect to play an active role in the scenario. Establishing a fiction contract attempts to minimize the blame a learner can place on the realism of the scenario affecting their performance. Next component is providing the logistics details about the session to the learners. During the briefing before simulation, educators often emphasize the session content while disregarding the logistical details. Some logistical details that should be included are the length of the session, location of the bathrooms, availability of the refreshments, breaks, and how to manage telephone calls, pages, texts, and even emails throughout the session. These, as they say, hygiene factors, if inadequately addressed, can lead to dissatisfaction and disruptions for learners. By explicitly outlining the logistical details, the learners can concentrate on the simulation session and be aware of educators are sensitive to the learners' other possible needs. Finally, pledging to respect the learners. To respect learners, educators must value the learners throughout the process. Instead of viewing actions as correct or incorrect, educators can inquire about the learner's decision-making process and rationale behind their choices. This approach provides the educator insight into the learner's knowledge gaps and helps guide feedback. Also, educators must acknowledge the belief that learners are bright, competent, and trying to their very best at their current skill level. As stated in the literature, each learner is striving to improve by communicating the importance of the learner's thought process. It conveys respect. Strongly and consistently, the literature states that it is imperative that the educators create a psychologically safe environment. This safe environment helps the learners to feel comfortable both making and learning from mistakes. Simulation educators can support and engage a distressed learner through debriefing strategies such as acknowledging learner feelings, giving the learner control, and using advocacy and inquiry questioning. By using this mindful approach, educators can lessen psychological distress, maintain psychological safety, and improve learning during simulation education. Another method to help with distressing simulation activities is ensuring transparency. Be clear about the learning objectives, outlines of the simulation, and the type of evaluation. Transparency fosters a relationship of trust and openness with learners. As we are all aware, it is very important that we include and address diversity and accurately represent the cultures of our communities. We as educators are strong advocates for the inclusion of diversity and priority communities, such as we have here in Hawaii, not only in healthcare curriculum, but in all learning environments. And as educators, we must continue to reduce the risk of harm to vulnerable and marginalized populations, increase quality of our teaching modalities, and achieve outcomes. In short, As sim educators, we need to get back to our roots of psychological safety to guide us. For example, when preparing students for simulation and formulating our pre-brief, it is important that we respect learners and value the learner's thought process. Again, as I stated earlier, this approach provides the educators with insight into the learner's knowledge gaps and helps guide feedback. As educators in simulation, we work towards excellence. Part of moving toward this excellence is remembering our roots and building on our foundations. We must continue to create environments where participants are well informed and feel safe enough to contribute to the accuracy and reality of the sim experience with true representation of our diverse cultures and communities. These are simple concepts, yet vital for the creation of excellence in our learning environments and moving simulation into the future. Mahalo for listening. Aloha.
Okay, everyone. Thank you again, all of you, for joining us for Healthcare Simulation Week 2022. And again, we're aspiring towards sim excellence in a new era. Dr. Higgins and I will be joining you shortly in a live Q&A.
Great presentation. Thank you so much for putting that together for us today. We do have a few questions rolling in. So the first one that I see here is there any structured order for the debriefing session?
Hi, that's me. Yes, there is a structure. And when I was looking at the literature, there was quite a few articles, recent articles within the last 2 years that were discussing that structure and how to ensure that pre-brief and the debrief go smoothly. A lot of the literature was talking about in the pre-brief to get a lot of the information out to the learners beforehand so that they can review it, so that they know what to expect. It's all about trying to de-stress them so that when they get to the learning experience, they can actually enjoy it and get a lot out of it rather than just be very stressed about what the content might be.
Great, thank you. I enjoyed hearing you talk about the missing roots that we have in pre-briefing. Are there any, you covered the things that we do need to discuss in pre-briefing, the fiction contract, learner safety, and all those things. But as an educator, do you have any specific tips for your favorite way to get learners engaged in your pre-briefing and have that be successful so they have the best experience?
Thank you for the question. Yes, so for me, I'm in healthcare. And so when in my pre-brief, I actually start a few days ahead of time. And I send the information, like for instance, a case study to the students so that they have that to review. And then I have them like look up the medications, look up the disease process. And then when they get to the simulation, we sit together and we go over that information. I answer questions about it. We make sure that we understand what the disease process is. We look at what our nursing interventions would be. And then so that they're really well absorbed into the content so that when they get in there, they're not so scared. The other thing that's I think is vital is to take them on a tour of the facilities so that they know what it looks like. They know where things are. They're not scared about trying to find things. Doing those types of things, I really see the stress come down and the students engage a lot better.
Wonderful, thank you. And back to you, Dr. Smitten. I was wondering in your discussion on data and how important it is to collect that. I know that we have a lot of people that are in smaller systems, may not have funding, may not have the personnel, may be new to simulation. So do you have any ideas or suggestions where somebody in a new or small program might start that doesn't have information technology on their side or anybody handling their data?
Yes, data science is just a must in this time and day, obviously, with this new era of simulation and new era of everything that we're doing with data, big data control. So I think one of the best things to do is to always refer back to the standards and look at what they require for the, if they were working towards their provisional accreditation, for example. So just having even the basics, starting out with an Excel spreadsheet and getting the information that they need to work towards having the standards that they need in the future for their own accreditation. And that gives them the framework for their future.
Right. I love that idea. I love looking at the provisional accreditation standards, even for a program that maybe that's not attainable right now because they might not be able to hit certain marks. It's a great map and a great place to start. So I think that's awesome. There are a couple of questions in the chat regarding standardizing the pre-brief and debrief amongst all SIM faculty with different courses. Are there any tips? Do either of you have any tips for standardizing that process? I know we have some centers in some areas where the faculty are in and out, or maybe per diem or adjunct faculty where they're not there full time.
Yeah, in my presentation, I went through some categories that I think need to be addressed when we were looking at, prepping and getting ready for a simulation. And I think if we follow those steps, I think, that's sort of our foundation at what we should look at when we're getting a pre-brief together. And as far as like looking at the disciplines, look at what kinds of things that you can send to the students beforehand, or look at what kind of introduction that you can give them before they go into their simulation, what to expect, give them examples. It's all about getting exposure to simulation, like to the content that you want them to simulate. And then I think that way they will be better at, participating in the sim. I hope that answers your question.
Sure, I think so.
Just to dovetail on that.
Yeah.
It really is important to, excuse me, again, focus in on the learner objectives. And if you always have that in mind, you'll come up with some key pointers or key articles or something to refer the learners to in preparation for the in situ, for example.
Sure, great. With regard to standardizing amongst your faculty or simulationists that are there, do you find that there might be use for maybe a checklist that would be easy for somebody that's not in sim all day and maybe is not as comfortable?
I agree. And in fact, I put for our simulation center, I put together a checklist because we've had quite a few adjuncts that are very interested in coming into sim. So I put a checklist together and very kind of detailed, like this is what you should do. These are some of the examples that you can use in order to present your sim, because I think it's about organization and getting everybody sort of standardized. And I'm more than happy to share that with anybody who wants it.
And actually further to that, we have some websites related to and links for everyone. If they wanted to just shoot their emails over to us, that we can certainly send everything over to them, including the Formula One article that inspired us related to, the fastest lab on earth, giving us this kind of an idea of what we need to do for simulation in the future.
Yes, awesome. I knew somebody was going to ask about that, and before they could even finish typing, you said that, so wonderful. And then I think one final question, any tips for in situ sim pre-briefing? So those in situ or in situ, however you say, depending on where you're from, I think. How would you do pre-briefing for those more in-hospital events?
I'm not sure I understand what the question is.
They're asking about pre-briefing for in situ simulation. So running, a simulation on a floor in the middle of the day.
Right, got it. So again, it's about organization. And so if you're going to run a simulation, you don't want surprises. right? So because it's the surprises that that make everybody very nervous, and then that's when I don't think a lot of learning can happen when you're so stressed and you know, very nervous about what's happening, where things are going. So if you're going to have, even like when you have drills, you want people to know that it's coming, right? So you want to make sure that they have that information ahead of time, that they maybe have a brief outline of what to expect. I mean, you don't have, like, we want to look at the level of the learner as well. So if we've got, you know, brand new nursing students, we want to make sure that we've got a lot of detail. We tell them exactly what's going to happen. Whereas if you've got we have a situation where we're in the hospital and we're doing an interdisciplinary simulation, then of course we want to look at the learners are very well versed in the content. We just want them to move through a simulation that that we might need practice in. So we don't need as much detail, but we still need to make them aware. We need to make them that the whatever information available to them beforehand. And again, when we're looking at, for instance, Formula One, when they go into their simulators for, on these, like, very, we don't put them in a car and say, okay, now drive as fast as you can. No, they go into these simulators. And when they go into those simulators, they're well briefed about where everything is, what that simulator looks like, so that they can get the most out of it.
Absolutely. I think with in situ simulation, there's probably some element of surprise there, but I think what I'm hearing you say is we're going to pre-brief for it. So it may happen 2 weeks from now on a Tuesday, but just so you're aware, when we come in and do this in situ simulation, this is how it's gonna go. Dr. Smith, did you have something to add?
And just, reinforcing again the learner objectives, making sure that you're focusing in on 1 or 2 key points to make them feel like, okay, I'm ready for this. I can handle this. And moving forward with making it as realistic a situation as possible.
All right, gang out there in webinar world, if you have some more questions, type those in the chat so we can keep this discussion going on. I think it's very fascinating to go through, the best practices for setting up these simulations so that you are successful and so that you are getting the outcomes to ultimately affect patient safety in a positive manner. I would say to both of you, what are some examples that you have from your simulation center that demonstrate some or all of the sim excellence topics, elements that you just discussed? What comes to mind and sticks out for you that, oh, when you read this article, you're like, we do this good. Yes, yeah, yes.
Well, one of the things we have to do better, and it's working towards excellence in that area, is the data sciences that was mentioned. And I know what you mentioned as well is when you're a smaller center, you don't have that capability sometimes to have the structured situations in the university that would help that, or an education management system, but you have to start from somewhere. So we're all working towards excellence in that, so that in the future you'll have those that information and those tools to be able to justify and validate and reinforce for the return on investment, which we always hear about, but also to validate, we are doing a good job in relation to the improvement in patient safety outcomes, for example.
I'd like to give an example. So in our simulation lab, as I said, we have quite a few new faculty with us, and their orientation to the sim lab when they first came in was very daunting. And so a lot of what I made sure we did is expose them to our sim lab, to our technology, and gave them tutorials to watch before they came in. And then when they went through the simulation with the students, because I had them actually go through the simulation with the students before they were on the other side of it, they found that it was really very enlightening to see just how stressful it was for them to go through that sim. And so by making sure that we're looking at all of the components that make up a good foundation for any simulation. I think that's what we're going to get the best benefit out of the process. So I think, again, I can't stress enough how important it is to get that exposure to the technology that you're using, to, you know, the content that you're going to be, you know, the content of the simulation, as well as just like simple layout of the land.
Excellent. Thank you both.
I see a question in regards to the OB, new person educator in the area. And one of the things that we've been working on in the last year too, we had an escape room with the OB scenarios, and that's going to be something, there's going to be an article coming up on that. But there's a really creative way to utilize your kinds of gaming, if you will, to find out about culture of safety in your area. So it's something you can utilize for training and educating in your world of OB.
Wonderful. That sounds like a great article. I'll be happy to read that when that comes out. Anybody else have anything? If not, we're gonna, you're being asked to share that scenario with the group. So if you're willing to do that, if you would include that in the things that you send out to these folks, that would be wonderful.
It's going to be an article that's going to hopefully be published. So all that information will be provided in the article.
Excellent. So just go ahead and do a search of Dr. Smitten's publications, and I'm sure you'll find it when it comes out. Probably subscribe to some of those professional journals, and it will be highlighted, I'm sure. So appreciate everybody's time. I don't see anything else going on here. Very informative to spend time with both of you as always, and happy Simulation Healthcare Week for everybody. Great programs put on all week, and I appreciate all the effort that a number of people have put into this. Thank you so much.
Aloha, and thank you, Kim, for moderating, and thank you everyone for coming. Happy Simulation Week.